on the development of culturally competent nursing care. Introduction. Culturally appropriate nursing care is important to address the needs of diverse patients, provide them with much attention, and demonstrate an understanding of their expectations. The aspect of culture can influence the quality and delivery of nursing care significantly because people belonging to various cultures are different in their perceptions and visions of health and care. Thus, nursing care should be adjusted to the needs of culturally diverse patients, and it is important to examine what particular areas related to culture can affect nursing care, what changes can be made to meet patients' interests, and how the learning regarding the cultural competence can influence the quality of the care with references to nurses' individual experiences. Areas that can influence nursing care. While discussing the culture and its impact on nursing care, it is possible to identify 5 areas that can have the most significant effect. The first area to discuss is communication with culturally diverse patients. Language barriers are observed if a patient and a nurse belong to different cultures, and the patient does not know the English language. The lack of understanding can lead to inappropriate diagnoses and ineffective treatment. In addition, much attention is paid to verbal and nonverbal communication, the principles of which are different in many cultures. For instance, the female representative of the Arab culture can avoid communicating with male professionals. As a result, she often does not report all complaints to the male nurse or leaves the facility without receiving any help. In this context, it is possible to discuss the second area, such as communication with the family members. In many cultures, the opinions of the family members and their statuses can be perceived differently, and the nurse should pay attention to this fact while asking the patient to make decisions regarding the treatment. The next 2 areas are the patient's specific habits, traditions, and customs associated with the culture and the religious beliefs that can influence the person's lifestyle. While proposing the treatment alternatives and developing the care plan, the nurse is expected to take the cultural and religious background of the patient into account. One more concept that should be discussed is the patient's attitude to the principles of Western medicine based on his or her culture. Different cultures perceive diseases and treatments depending on their traditional visions. For instance, Hispanics distinguish between hot and cold diseases and treatment alternatives, and they can be rather skeptical regarding the proposed treatment plan. However, certain adjustments to the principles of nursing care to make it culturally competent should be made. To overcome communication barriers, the nurse needs to pay attention to the patient's language and communication patterns and ask interpreters, family members, and representatives of the same culture for help. The next step is the demonstration of respect for cultural differences and personal attitudes and visions. The nurse should learn about the patient's visions of illnesses and their treatment, approaches to diagnosing, and aspects of communication, such as consultations with male doctors. The nurse should also learn about the patient's traditions and lifestyles to understand their daily activities and habits in order to develop a comprehensive care plan. The next step is the choice of the appropriate treatment that can be perceived by the patient as the most effective one according to his or her vision. Changes regarding the cultural competence. The results of the previous cultural competence quiz demonstrate that such areas as communication, as well as the understanding of lifestyle and child-rearing practices, require further improvement. After working on enhancing skills and providing culturally competent care, it is possible to state that the results regarding cross-cultural communication have changed. The learning was important to promote the understanding that it is impossible to make assumptions regarding patients' beliefs and visions, and the effective approach to resolving the issue is the practice of asking polite questions and contacting family members to learn about values and traditions. Improvements are also observed in terms of demonstrating respect for the patient's culture, support group, visions regarding health and medicine, and relations in the family and community. Positive changes are also observed in terms of understanding gender roles in different cultures, as well as the impacts of cultures on lifestyles. These results allow us to speak about changes in the quality of the nursing care provided for culturally diverse patients. Positive effects of learning on the nursing care. While discussing positive changes in the nurse's cultural competence in detail, it is important to state that learning about diverse cultures, traditions, religions, and beliefs has affected the understanding of culturally appropriate nursing care significantly. The focus on cultural differences and the development of cultural competence allows the constant examination of individual patients' needs and interests to provide them with the appropriate care. This approach also allows for analyzing the appropriateness of the proposed interventions and developing the communication most respectfully. As a result, the learning of the cultural contexts and patients' beliefs and visions allows nurses to become more attentive, respectful, and responsive while communicating with patients. The learning and development of cultural competence are also important to improve the daily provision of nursing care. For instance, the knowledge regarding patients' cultures contributes to listening to persons' complaints and visions, as well as explaining their expectations regarding care delivery. As a result, it is possible to acknowledge patients' needs and discuss the particular case with professionals from the patient's culture to demonstrate competence and respectfully provide the most effective care. Learning about cultures is also important to avoid cross-cultural conflicts, develop positive communication, and demonstrate respect and loyalty. Conclusion. The constant development of cultural competence is important for a nurse in order to adjust the care to the needs of culturally diverse patients. The ongoing learning and development of skills are necessary, and much attention should be paid to addressing the areas related to the culture that can affect the quality of the provided nursing care. The regular analysis of cultural competence allows for monitoring changes in the approaches and meeting the patient's interests. Therefore, it is possible to state that learning allows for improving cultural competence and the quality of the provided care when individuals' needs are met.